All right. I'll go ahead and get started, and I'll just introduce myself this morning, and just want you to know as well that you are welcome to post a question in the chat if you have any. Renee, thanks for already leading the way in that. Renee is one of the members of our Parent and Family Council, and I'm also very excited to welcome Kristiana Holmes, who's going to be presenting on behalf of the Health Center. My name is Rachel, and I work in the Office of Alumni and Family Engagement. I am the primary contact here in our team for parents. And so if you are a parent, guardian, or family member of a current student, you've come to the right place. And I'm really excited that you're here. Kristiana, do you want to go ahead and introduce yourself, and you can start your presentation.
Very good. Well, thank you, Rachel. Thank you for inviting me here today. I'm so pleased to be with you and appreciate coming at this time frame. As Rachel was sharing a little bit earlier, usually these are at noon, so this is kind of a departure from that for various reasons. So I appreciate you adjusting to this different time frame. Anyway, my name is Dr. Kristiana Holmes. I am the Director of Health Services here at Whitworth University. And I am, again, pleased to be with you here today. I'm going to cover a little bit of information about what our services are. And I have some slides. They're very basic, but just kind of to go through the general information about our services, and then maybe talk a little bit about some of the things that we're seeing on campus related to health trends, and then just maybe open it up for you to ask questions that you might have about health and your students' experiences on our campus, and just anything that you're wondering about. So I have shared my screen, and I'm just going to pull up the slides and get them a little bit into our presentation mode here. Is everybody able to see them? And Rachel, I might have you give me an affirmative. Okay, yep. All I can see are the slides now. I can't see any of you. So
sure thing.
But again, welcome. It's so wonderful to have you here. Health Services at Whitworth University, I just want to say kind of at the beginning, our purpose here is to provide high quality healthcare that's focused on the well-being of the whole person. And we are right here on campus, and we'll talk a little bit more about that as we move forward. We do keep students moving toward their educational goals. And what I know and understand about students and sometimes the reasons that they might exit our campus and our institution, the top reason is health. And so as we connect with students, we want to make sure that we are partnering with them to accomplish not just their health and well-being, but also keep them on the trajectory toward meeting the goals that they have for their education and stepping into a career and so forth. So health is intimately tied to that when you are a student on campus. And so we'll kind of keep that in mind as we move forward. So our mission at Health Services is upholding our core values. We provide confidential healthcare services for wellness of body, spirit, mind, and heart. And our team partners with students to empower their optimal well-being and educational success, as we have just discussed. Our core values, if you are wondering, and this is also identified on our websites, in all of our materials that we give to students, we want to provide personalized care, and that care is looking at students holistically, equitably, and with an inclusive lens, being respectful and offering that care, that personalized care, with cultural humility. We want to provide compassionate care, so care that is offered with empathy and personal humility. Our care is relational, and I can definitely vouch for that as far as how we approach our students. We want to be approachable, and we want students to consider us trustworthy. So we try within that relationship to provide compassionate care that exudes that. We also want to uphold transformative care. Care that we provide should be innovative, empowering for students, helping them establish self-advocacy and understanding of health literacy, and care that really changes their lives for the better. So that's a little bit about kind of our tenets, our philosophy here at Health Services at Whitworth University. So what are the essentials? We are an on-campus clinic. So in other words, we are located here in Schumacher Hall, which is just steps away from residence halls and classrooms. So your student does not have to travel typically to receive their health care. We provide it right here. We do serve students only, so we don't see employees or folks from the larger community. We are focused solely on students who attend Whitworth University. The professionals that work here are college health experts, and that means that when a student comes to them, they are focused not only on the typical clinical scenarios that we might see in this population, but also that they take into consideration what's happening in that student's life as a student, because there are many factors that impact health, and they take that into account as they are connecting with your student. Our services are appointment based, so it's very much like a clinic that you would go to in your hometown or in your community. We do have something called triage available, and we'll talk a little bit more about that. You may know what that means, but I'll touch on that a little bit later. And as mentioned, we are located in Schumacher Hall, which is surrounded by our campus residence halls and classrooms. And so that little arrow points to the north side of the campus, and that's where we are. We are sandwiched among all of the other buildings. So many people have questions about costs for our services. We do not bill insurances. Your student has, when they pay tuition and fees, they have paid a fee that covers, generally speaking, the majority of our services. There are some services that may have a low cost, things like immunization, travel health exams if students attend an off-campus study, and a few others. But generally speaking, if a student enters our space, sees our healthcare providers, that visit, they come in and exit with no cost to them. If there is any cost that's associated with the visit, that payment is due at time of service, but most students charge it to their student account so that they can pay for that as they pay off their student account, other student account charges as well. The triage visits I was mentioning before, there is no cost for triage, and that is a really easy way for students to engage with a healthcare provider here at Health Services to determine, do I need to come in for a visit? Can I do self-care for whatever it is I am dealing with? Or is there some other level of care that I need to explore? And our registered nursing staff talk with the students directly, and they may see them in person to do that, or this may be a phone call. And our RNs are very skilled at addressing whatever that issue might be and getting the student to the right place.
Kristiana,
yeah.
Is that service available for students who live in off-campus housing and are not in the residence halls?
Correct. So all of our undergraduate students receive services at Health Services. And we do have some the doctoral programs that are on campus, and the Master of Science in Athletic Training. Those programs also are able to receive our services and pay the tuition and fees that cover that service. So yes, very much our off-campus students are able to utilize our services.
Great,
Thank you for asking that. Yeah. So the staff that we have here, we have advanced registered nurse practitioners, we have registered nurses, we have psychiatrists, We have data and program specialists, which focuses mostly on front desk administration, but also our electronic health record. And your student has probably engaged with that person already in communications when they entered our university. And we also have a program coordinator who helps with our front desk and also works with our uh, student leadership group called the Health Education Action Team. Our program coordinator is the coordinator for that group as well. And just so folks are aware, we are co-located with counseling services, which is a really nice partnership. Many of our students do see folks in counseling services, and students who receive counseling may be referred to us in health services for their care as well. So we work very closely with our colleagues in counseling. I have a whole list here of our services, and there are more than this, but this is kind of a general look at what we do. It's basically like the care that you would receive in your own, community clinic at home. So acute and chronic illnesses, minor injuries and procedures, physical exams for preventative care and health screenings, immunizations, mental health care, psychiatric services, sexual and reproductive health care, and then social, cultural, and environmental needs. We do see students who maybe they're experiencing allergies or something of that nature, and it's impacted by what's in their environment. And so we want to make sure we know and understand what's going on there. We talked about triage. We do have lab. We do provide some lab services that are on site. Lab services that are off-site, usually we are able to draw or prep that lab, and then we send it to our lab partner in the community, which is Insight Diagnostics. Students who need x-rays, we do not have x-ray capability on site, but we do set up the process for students, and they go to an off-site location for x-ray. We see students for general wellness. Sometimes that includes nutrition, and we partner with Sodexo, that is our food service on campus, to provide nutrition and kind of food health information. We do refer to specialists if a student needed to see an oncologist, well, hopefully not an oncologist, that probably wasn't a great example, but an orthopedic specialist or a dermatologist, something like that. We are able to provide referrals to specialists and also help the student navigate that process. And one thing that I really like to highlight is that we provide health rides. So we have some students who are here and don't have a vehicle. And they may live on campus or off campus without a vehicle. So if they need a ride to an appointment that isn't through health services, but maybe we've referred them to a specialist, they have access to free rides to get to those appointments. Or if maybe they have a regular ongoing appointment, like a physical therapy appointment that they have to go to every week, and they don't have transportation, we can provide health rides. And so they just connect with us and we help them manage that process. So for parents, this is an important slide, or guardians or folks who are connected to the student here at Whitworth. The healthcare that we provide here at Health Services is confidential. And so basically that means that even if you have an interest in what's happening for your student from a healthcare perspective, they need to give permission to us to communicate with you directly. So that healthcare, again, is confidential. We can only provide information if the student signs a release of information. And many students do that for their parent or guardian or a significant person in their life who they want to have it engaged with that healthcare process. But if that hasn't happened or that doesn't happen, our services are strictly confidential. And we do try and provide our services in a safe and caring environment. We definitely want that student to feel safe so that they feel that they can provide accurate information to us about their health and well-being. and then done in a caring manner. And I can definitely say that the staff who work here, our healthcare providers, they genuinely care for and love our students. That is why they are here. So health services does have to abide by federal laws. One law is called FERPA. It's the Family Educational Rights and Privacy Act. And basically what that means is just what I'm saying here, that the services we provide are confidential and legally by federal law have to remain confidential. We also abide by HIPAA, which is something you might be more familiar with. This is another federal law that says we have to provide care confidentially, and that if the patient or the student wants to share information, we have to get that in writing from them. So sometimes that's news to parents or guardians, and it's helpful to maybe know that information. So
Before we
one of the
move
things,
on, can I
yeah,
ask a couple questions that are in the chat?
absolutely, because I can't see it, so definitely interrupt when you need to.
Perfect. Thank you. Okay, so we have one question. For students doing Whitworth study abroad, is your clinic able to do all the immunizations required for those trips?
That is a fabulous question. So any student who travels off campus, studies abroad, they come to us for basically it's a pre-travel visit, and we work in conjunction with faculty to know what programs are going, what their destinations are, and then we do the research on what immunizations are needed for that travel. And there are a number of immunizations or things like malaria care
Mm,
that we would directly be able to provide. There are some immunizations that we don't carry here, but that we can refer students to a location to access that immunization. The reason we don't carry all immunizations is because they are very, very costly, and
okay.
we have to order them in quantity. And so if only 5 students in a given year need like a yellow fever or some sort of immunization that we don't typically, have for our routine immunizations, it's more costly for students to receive that here than it
Mm,
might be elsewhere. And it's costly for us to have those immunizations here. But that said, we do have some of the basic ones. So they might be able to receive everything that they need here in their pre-travel visit, healthcare visit. And if they can't, then we get them to the right place.
wonderful. A couple more questions. What
Yeah.
percentage of students utilize counseling mental health services on campus?
So I'm not sure that I have that specific data point. I can tell you that in health services, probably about somewhere between 20 and 30% of our visits each month are specific to mental health. So for counseling services, I want to say that this is a general number. Maybe 10% of our student population, though those numbers might be higher now, of students probably would receive counseling services. So it's a subset of our general college population, and those numbers have been on the increase over the past, probably 5 years. But from a health services perspective, we see a lot of mental health care here because we connect with the student, we diagnose, and if there is something that is needed for care, it might be counseling, it might be medication, and it might be other things, a referral to another campus partner like accommodations.
Mhm.
Those things we can do and help that student navigate or create referrals for. So we work really connected in a connected way with counseling services and also with some other services on campus to support kind of, again, that whole person view from a mental health perspective. So I don't know if that directly or specifically answers how many of our students see counseling services, but hopefully it gives some context around that, and what we see in health services from a mental health standpoint. I would add on to that that we also have psychiatric care, and the number of students who see psychiatric services specifically is a low percentage of our general population, but I can tell you that that number has increased over time. So we are very fortunate to have a psychiatric provider who works with us and with our students. I wish we had more time, psychiatric service time, but we are fortunate that we do have that right on campus and that it's accessible to students.
One in follow up to that question, one parent wondered, it's 10 free counseling visits per year that are included in their tuition and fees. Is that correct?
Yes, so counseling services, and I will speak for them very basically,
Of
but
course.
for counseling services, they do have a short-term focused model, and so 10 visits is generally the guide for what that would encompass. So that is a good and solid number to kind of have in mind when you're talking about counseling services for students. And
Um, the question,
that repeats
oh,
yearly.
yearly. Great. A question here, back to the confidentiality slide. Are there any
Yeah.
exceptions to confidentiality, any scenarios where you find it important to reach out to parents or guardians?
Yes. So those scenarios are very specific. But if that student is a risk to themselves, and when I say a risk, I mean an immediate risk or a risk that is likely, uh, that is one scenario where we would be contacting emergency contact or a parent guardian, and also notifying others in specific areas on campus. So if imminent, that's the word I was looking for. If it is an imminent risk uh, to self, that is one scenario. If it is an imminent risk to others, that is another scenario. Or if that student is gravely debilitated, in other words, they are unable to make medical decisions for themselves, then we need to reach out to their parent, guardian, emergency contact, whatever that might be. So that is an excellent question because there are exceptions to the rule. And just maybe to also highlight that if a student isn't an imminent risk, but they are struggling with some of those issues around, self-harm or harming somebody else, there are other factors in play and
Mm.
other areas of campus that step in to support that student and either get them the help they need or make sure that they are safe on a kind of daily, ongoing basis to the best of our ability, right? So even if we can't share that that student has had suicide, there are many of us, many students who have suicidal thoughts that don't put that student at imminent risk. So we work with those students either in health services or in counseling services or both, and psychiatric services to make sure that they are safe and do our best to make sure that they have what they need. But the threat isn't always imminent. And so that's where most of our students sit when they are struggling. And so
Mm.
just so you are aware, we do work with those students. We may not be able to communicate those things directly unless the student has given us permission to do so. But we fold in other services to make sure that we have kind of eyes on those students when they are struggling, even if it's not an imminent situation or that it's a likely uh, thing to occur or happen. So hopefully
Thank you.
that
Yeah.
yeah.
And Eric, if you have a follow up to that question, feel free to type that. I know as a parent uh, who had two students here, one had a medical emergency, and it it resulted in a mental health crisis. Started with physical symptoms that turned into a mental health situation, and another actually a similar situation. And I know that as parents, we can sometimes be concerned about just having somebody get their eyes on our kid, like if they're,
Yeah.
not leaving their dorm room, etc. And I think that speaks to a little bit of what Kristiana was mentioning in terms of incorporating other campus partners in
Yeah.
that risk assessment. If you were here during parent orientation, I'll just remind you too about something that's called the early alert system that we have here at Whitworth. And parents can submit an early alert. You can do that anonymously if you prefer. If a professor or somebody in residential hall life, or even, somebody, a staff member working in the dining hall who's used to seeing a student on a regular basis for a certain meal and it's been a few days. Any of us that have a concern about a student, something seems maybe just a little off, or we actually have knowledge of a struggle, if it's academic or if it's
Mhm.
mental health, we can and you can submit a early alert on behalf of your student, and it gets reviewed by a team of professionals. Kristiana, are you on that team? Do you represent health services? How does that work?
So the students, the folks who work through student success, I am not necessarily a part of that group that meets regularly. However,
Hmm.
um, when there is something that might be connected to health or healthcare, then I get pulled into the conversation. So I don't do it. I don't sit with it regularly. I'm more of an ad hoc when it's specific to something like that. Molly DeWalt, who is our counseling services director, she is with that group, and several others. And like you say, it's folks even from academic areas and so forth, because we're trying to take this kind of wide view of well-being and what that looks like.
Just
So
a final follow up on what happens if an early alert gets submitted. They work hard to identify a member of the Whitworth community that would be the most appropriate person who has the connection or the relationship with your student to engage with them and reach out to them. So if it is a potentially imminent mental health crisis, I'm sure that triggers a process with the health center, with health services and or the counseling center. If it is not necessarily a mental health crisis, if it's academic, it would trigger a process within the registrar or with academic affairs. If it is a situation with a roommate that is getting out of control, it would then bring in the people from residence life. So it's a great way, if you don't know who the people are on campus who may be able to support your student best, to get your concern into a process that is meant to be a safety net for your student. Okay, I am so sorry to interrupt you there, Kristiana.
no, it's all great information and so
Did you
appropriate.
have more slides that you wanted to
I
share with
just
us?
yeah, I just have a couple, and then we can just kind of open things up. Um,
Great.
so I did want to share that we are operational and see students from 8 a.m. to 4 p.m. Monday through Friday. So we're kind of standard business hours. And as you know, students on a college campus do not just need healthcare 8 to 4. So there are resources for after hours care in the community, and those can be easily found on our website. And it also provides some directions like how to get there. There's an urgent care that's literally less than 2 miles. It's a straight shot down Hawthorne Road. And there's an ER, hopefully that is never the case, but there is an ER, and it's less than 10 minutes away. It's probably like a 5 to 7 minute jaunt. And as I mentioned earlier, there are health rides available for appointments that take place even during business hours, if they're going to see a specialist, or they have a, as I said before, something like a physical therapy visit, and those are available 24/7, all day long, every day. So I think that's a lovely benefit that our students have, and I'm so pleased that we can do that, especially for those who don't have vehicles accessible. So I wanted to also flip up just kind of a generic, here's our contact information. If you ever have questions or concerns, or you're wondering something about our services, please feel free to reach out, and we will help as best we can. If it's a question directly about your student, please ask them first. And if you want to be involved in that, in their healthcare, they can sign a release of information through us, and then we can provide, conversation or other types of information connected to their health and well-being. So that is all I have as far as slides. So I'm going to stop sharing. And I had thought of one other thing, and now I hope it comes back to me. When we were talking about early alert, I think I remember. One of the scenarios recently that I've actually had two students that I've been alerted to with health-related concerns. And these are two students who have maybe received a healthcare diagnosis that is new and unexpected and somewhat significant. And so when that happens, it can be overwhelming for students, especially if they're separated from their community of parent, guardian, or significant people in their life. And so what I hope and what we offer is not just for them to come for a regular healthcare visit here, but for them to come and connect with me directly, because I can visit with them and help try understand what maybe is happening for them from that new diagnosis perspective, and just sit with them, be with them, and also help them navigate this potentially new experience in their life, which is, very concerning, anxiety producing, especially if they don't have their support person right here. So just know that those, conversations or time together is offered to students who may be going through some pretty significant health issues when that does occur. So yeah, if there are other questions, I would love to try and field those, or just comments or wondering.
Are you able to see the chat window now? We had a couple questions there at the end.
Here we go. There it is. Okay. Let's see. I'm going to scroll back and make sure I've got it. We talked about that one and the scenarios. Oh, okay. So I'm going to go to, it's from, I believe, Becca. It says, how can my pre-health student get involved with a health clinic? Great. Another great question. I'm going to say that because there's no question. They're all so good. They're just very pertinent. So if you have a student who is in a pre-health academic structure, they have an opportunity in two ways. The first way is, I think I mentioned it early on, we have a student leadership group called the Health Education Action Team. And these students are involved in health programming for their peers. So we do things like, it's something called Club George, where it's this huge event, there's a dance, we talk about substance use, alcohol use, all of that, and we try and educate students on that while in a fun environment that is substance free. We've already done that this year. It was fabulous. We do things like the Scallywag Scurry, and that is a 5K run right here on campus, and a bunch of things in between. And so those events are put together, developed, coordinated by our Health Education Action Team, our student peer leaders. And so each year, sometime around March-ish, April-ish, there is an event that is a student leadership fair, in essence, and students can apply for different positions, student leadership positions on campus, and ours is one of those. So the Health Education Action Team is it's a paid position, and it helps students who may be in pre-health academic courses get a little bit of a glimpse and practice in doing some programming connected to health and well-being. And I love it. The other way that students can engage in or be connected to health services is we do have one student employee every year, and that job becomes open usually around that same time frame that the heat applications come around March or April. So those are ways that pre-health students can get involved. Okay, and I think we answered the 10 visits. Yes. Oh, Becca, you answered that. Okay. I have some concern about Washington family laws. I don't mind being the brave one and asking questions others are thinking. So maybe, Eric, is there something specific that you are wondering?
I think Eric may have been referring to answering when I said if he had any additional concerns.
Gotcha.
He was the one who asked about confidentiality to begin with.
Yes.
So that was
Yes.
great.
Got it. And you know, Washington law, yeah, there is confidentiality for some aspects of young people's care starting at age 13. That is very young. So yeah, it's very interesting. Okay. So maybe Ulrika, if I'm pronouncing that correctly, and my apologies if I'm not, health insurance plan does not cover out-of-state providers. Considering changing our plan for next year, Whitworth covers most health issues. What are your thoughts on this? Yes. So we do not have health insurance like a student health insurance plan because of our structure. Oftentimes that's not needed for most of the things that students come to us for. That said, it is very helpful for you to have a health insurance plan that does cover healthcare in the state of Washington, because not everything that students experience we will be able to do. So just like your primary care provider, you can't go to them for a surgery for an appendectomy. You need to go to the hospital, have that surgery there, and so on and so forth. So if a student's in an emergency situation like that, not having healthcare that's covered in this state can be challenging and costly. So I do recommend that you see if there are ways to have at least catastrophic health insurance that can cover things that may be beyond a primary care practice as far as a health issue. So that's another great question, and a concern that many people do have if they're coming out of state. Is there any follow-up question to that in particular? And I'll just, if anybody wants to raise a hand or anything like that.
Can you hear me?
Yes.
Hi. Thank you. You did say my name correctly. Almost. But no, that's exactly what I wanted to hear. Thank you. I will definitely look into doing something for this next year.
Yeah.
We've been lucky so far, but
yes. If you go to I'm going to try and type it in right now so that I give you the right website. But you can go on Health Plan Finder. That's what it is. I'm going to try and post this in the chat. I'm going to come back. So this is Washington Health Plan Finder, the link, and you can search for health plans that would be accessible in the state of Washington. Okay. So I am going back up. October Sexual Awareness Month is a clinical topic or student services, but what awareness means are being done to educate students. Some students have, yes, what dating safety education is happening. I wish there was more. Yes. Okay, so that's a lovely question. And when we do the Club George event at the beginning of the year, that is very purposeful. The timing of it is very intentional, because we do have students who are coming to our campus who maybe haven't dated, or they're very naive to dating experiences. And so, as you may well know, dating and substances sometimes cross over. And so when we host this event called Club George, we provide information about substance use, and we connect that to sexual assault awareness. And so the probability of sexual assault increases with substance use, in particular with alcohol use. And so we try and educate students about those two pieces. So for sexual assault awareness, or Sexual Awareness Month, our health education action team also puts out information on social media, on newsletter posts, and things of that nature, to get information out to our students that talks about safety and dating safety and so forth. So we do try and target that topic at least once or twice throughout the year, and that doesn't seem like a lot, but we have kind of some things running in the background as well. We're not the only ones who provide this type of information. In the residence halls, they also talk about these issues as well. But that is it can be a big concern for a lot of parents and guardians and significant others to our students. Okay, I think I've gotten all the ones that are already typed into the chat. Is there anything else that folks are wondering about? You don't have to be shy. If there are not additional questions, I do want to share that you can always contact us here at Health Services, and you can then contact me directly if you have questions, concerns, things that you're still wondering, things that you didn't think about when you were in this space, and I will do my best. To mention that, yes. So we can, thank you, Becca. Health trends on campus. So right now, we are definitely and very early seeing flu. We are seeing COVID. So I strongly encourage you to encourage your student to get vaccinated, because when they don't, I can guarantee you, based on experience, that if they do get ill, it will be worse and longer, which means that they are out of their classes for an extended period of time, and that is challenging. Missing a day of class is hard. Missing a week of class is significant. And we have very empathetic faculty here, but it is still a challenge. So those are some infectious disease health trends that we are seeing. I would definitely say that we are still seeing, the mental health issues, anxiety, depression, that will fluctuate throughout the year. So we have definite times of the year where we see that more, and we are going to be entering into that one of those phases as our daylight hours shrink and our dark, becomes more prevalent. Students can struggle with things like depression, sometimes with anxiety, but that trend continues. One thing that I would like to say about that trend is we are in a space right now in our country and in our society where we are kind of hyper alert and hyper aware of things like depression and anxiety in our youth and in our young adults. That is a good thing, but it also comes with layers. So students who experience anxiety and depression may be experiencing that because they are in a different setting. They are making a transition, perhaps from home to school, or maybe they've been here and they're in their senior year and they are approaching graduation, and that comes with all sorts of new things, new experiences. And so some of the ways that we experience emotions and mental health, as you know, are part of life. And so we also work with students to not pathologize all of those experiences, but to get to the heart of, is this really a clinical thing, or is this an experience thing? And so when we talk about mental health, we don't want to, as I say, turn everything into a clinical issue. Sometimes it is just a student, a person, a young person experiencing life, and maybe new things in that life that they haven't had to, they haven't had to traverse that road before. And so it's so important for you as a parent, guardian, or significant person in their life, and us, to help them with coping skills as well. So just getting through the first time that maybe they don't do well on a test, that can be a real hard thing for students. Or they're not doing well in a class overall. That can be really hard. But we can say to them, you know what? It is hard. It was something you experienced, and you will get through this. And now you have learned maybe how to do this differently, or that maybe you need some additional support. So it's helping them with coping skills as well, because the mental health crisis doesn't mean that every single student experiencing mental health concerns has a diagnosable issue. Some do, and I don't want to minimize that. But some just need help and support to get through the regular stuff of life, which comes with a lot of bumps along the road. So, and then a question did come in, does the clinic do flu and COVID vaccine? Yes, and I will put the little caveat onto that. We have flu vaccines here. We do not carry the COVID vaccine, but we do host flu and COVID vaccine events on our campus. And there's the COVID event is coming up November 7th. Flu shots, we just had one. I think we have another one on the 24th of October, and that will also be on the 7th of November. So they can come here for the flu shot, or they can go to one of the events. And we don't have COVID shot here, but we do have them coming on November 7th, and we'll have another one coming as well. They can also go to any local pharmacy. If they have insurance coverage, those are usually given for free, because I shouldn't say for free, they're covered by insurance. If they don't have insurance coverage, it's great to get them here on campus because they can get them for free.
I just wanted to quickly piggyback off of what you were saying in terms of maybe the word you didn't use, but I'm going to use, is sort of normalizing the stress that can come with the college experience. I met with the Parent and Family Council just last weekend, and there are some of the experiences of being parents or guardians of young adult learners who are living in residential campus settings that I think we're learning we need to normalize for ourselves as well. That it can be very stressful and anxiety inducing when you don't know how your student is doing, or when maybe they experience their first failure on an exam or a relational stressor on campus, and you're worried about them, and kind of learning how as parents to be that supportive presence without shielding them from having to live the experience themselves and gain the experience that they need to become self-sufficient adults at some point. And it's a continuum. We all know it's a continuum. So I just wanted to let you know that over the next months, the Parent Family Council, and hopefully parents like you who joined us today for this meeting, we're going to be looking at ways that we can offer a listening ear and kind of coach our peers together to allow our students to experience failure when it comes, and to help connect them with the kinds of support that is so readily available in so many corners of campus when they do need that extra support. To not have everything that is difficult or challenging, adversity, always be characterized as outside of the normal sort of experience that, I mean, most of us have had been shaped by adversity, right? And adversity can actually develop grit and perseverance and resilience, and those qualities that, as parents, we want to see grow in ourselves, but we also want to see grow in our students. So just know that there'll be more coming out in the next year from a parent perspective, and it makes me very grateful to know that there are professionals, caring staff like Dr. Kristiana Holmes and like her team, who are here caring about our students, and letting us actually take more of a parent role, because we know that our students can connect with those support services across campus, and begin to develop lives of kind of independence and stand on their own 2 feet, and that we'll be able to successfully, and that's a broad term, but we will be able to launch adults that are independent. So thank you for being here with me today. Do you have any other questions, anybody else, before we wrap up? And anything else from you, Kristiana?
No, I just want to say thank you. And there are some students, believe it or not, there are some students on campus who don't know we exist. And so if your student is one of them, please just share with them that we are here and accessible to them. And I want to thank you as parents and guardians and significant people in the lives of our students for doing what you do, because they have come here, gotten here, because of the village behind them, so to speak.